everyone. Welcome back to the Reconnect Health podcast. You are in for a treat today because we have Alicia Trenum, who is one of our massage therapists here at Reconnect Health Center. She has a very niche interest in working with pregnancy patients and working with infants and pediatrics. We're going to focus a little bit more on pregnancy today because in the fall here at Reconnect, we really do a big focus on pregnancy. Also, she wears another hat in that she is trained as a doula and is the owner of Whole Mama Collective, which is a birth education, birth preparation, and course content delivering company. As well, she organizes matching local doulas with families. So, thank you for coming today.
Yeah, thanks for having me.
Makes me tired just introducing all of the things that you do.
Just like one hat, two hats, it's all good.
Well, it's nice because they interchange very well, right? Yes. And so I think it's education that can very easily be adapted between both of the clients that you work with, right? Yep. So how about we start with how I met you, which was as a massage therapist, right? And maybe you can speak to a little bit of how you developed this niche interest of really wanting to work with like the prenatal postpartum population for massage therapy.
Sure. So when it came to, I'm actually almost up at 8 years into this industry now.
It goes by fast.
I know, eh? Yeah. You met me before, I think, I even started my massage career. So I went into it just doing general public. We learned like a very small bit in our education program. It's a 2-year program about pregnancy. And I realized like, wow, there's so much more to that. And like your body is going through so much change in such a short period of time. So how can manual therapy in general have an impact on it? So I started to kind of look into more courses, took some additional courses once I got started as a practitioner. And then obviously steered into learning more about pregnancy, which led me to become a childbirth educator, which added just some more foundation of understanding the changes of the body, that is happening through each stage of pregnancy and postpartum.
Right.
I became super passionate about it. I'm sure if you asked me like 12 years ago, I don't know if I would have I don't know if this is where I was headed, but now I'm here and I'm all in.
I feel like it's funny because we talked to like a lot of women's health or pelvic health practitioners and they all say the same thing. Like I had gotten into some other avenue and I found my way into this kind of niche population and then they end up loving it.
Yep.
Like, I think it really is, what I find from my practice is such an appreciative group of patients. Like, they're so happy to have someone who's taken special interest. And as you said, it's not, like, this is not typically part of massage therapy curriculum in that you're not given, a tremendous amount about pregnancy, right? And so you really have to be motivated and passionate enough to go seek further education to work with that population.
Yeah. Well, everyone can say that they're trained in prenatal massage, like to a certain standard based on what we learned in our program. It's just like there are practitioners like myself who have gone out and done those additional courses, as well as like information on like something like breast massage. And then I got into infant and pediatric massage because we have to go a little further. And interestingly enough, I've been taught even by like physios and things like that because it's not just massage alone. So kind of gives like some different perspectives into my training too. So
yeah. So why don't you maybe like tell our audience what are the typical types of like aches and pains and complaints that you see with a pregnancy massage patient? What typically ends up on your table?
Yeah. So typically what I see is a lot of lower back changes, hip changes, difficulties in the day-to-day life. People being told like, you're pregnant, so it's going to hurt, or you're pregnant and you're going to be uncomfortable. So I want to say a lot of it's like postural. A lot of it's like changes when it comes to low back, hips, pelvic floor, all those things. And then even including some abdominal stuff. So people who are having discomfort with activating their core and realizing that they've already got some separation going on, and how we can help them with their body changing. Obviously, we know through 9 months, like we're stretching, we're growing, our organs are literally rearranging. If any other part of our body was to do that in that 9 months, there'd be a lot of discomfort. So the like musculature of our body has to be changed and fascial treatment has to be done too to accommodate that. So realistically, as a massage therapist, my goal is to keep you functional, keep you thriving, and not just accept that we have to hurt in pregnancy because we don't need to do that. There's a lot we can do and people just don't realize that it's out there.
Right. I think it's so good that you touch base on that because I find that's something, it's almost normalized that like, well, you should have pain during pregnancy, and because it's normalized, then women aren't necessarily encouraged to go seek treatment. Or it's like,
Absolutely.
well, it will get better once you have a baby. But like, there's so much life to live while you're pregnant. And I feel like it's a high pressure situation anyways. A lot of women are trying to get like a number of hours in their work done. Yeah. They're trying to like get to prenatal education classes. They're trying to decorate a nursery. Like they've still got a lot to do, yes. even though they're pregnant. And I feel like I find it's a common story that women feel like they weren't really listened to when someone told them that they had pain. And so like pelvic girdle pain, sciatic-like pain.
Sciatic's huge, and it's not even always necessarily true sciatic that we're seeing. It's just like symptoms of compression of the nerve versus like actual nerve damage and injury. So, you know, it gets to the point where it's so bad, and we could have done something about it in the earlier stages if we had taken that preventative approach.
Oh my gosh, that's a pet peeve of mine. I'm like, why did you wait until you were limping in here? Yes. Why didn't you come in when it first started?
When life can't happen anymore, then you're like, oh, I better do something.
Yeah, because you're right. We see them by the time when they like, I can't walk for more than 5 to 10 minutes. I can't roll over in bed. Standing up hurts. It's like, no, come in when you first feel that happen.
It should just be habit. I mean, I always recommend to my clients that even if you feel amazing and you're at the top of your game and you're pregnant, you should be coming once a month at a minimum. Yeah. If that's something that your insurance allows and you're privileged enough to do that, once a month is great. Some people I see more, some people I see less, but really listen to your body and like what it's feeling in those different changes. First and second trimester might feel amazing. Third trimester, I know in my own experience being pregnant, it hit like a ton of bricks. So with my second pregnancy, I was more preventative with it. I started right from the beginning with everything, all the practitioners.
I do think for someone who's experienced pain in a previous pregnancy that they're a little bit more aware to get on the ball a little bit sooner in the subsequent pregnancy. And I do want to say because I find there's kind of a myth out there that like if you've had pain in one pregnancy, you will have pain in another pregnancy, and if you have pain in a pregnancy, it won't go away until you deliver the baby. And I have seen that that's not true, right? So I've seen lots of people who've had very bad pelvic girdle pain in one pregnancy and then do fine in a subsequent pregnancy. And so it's hard because research in pregnancy is difficult, ethics wise. And I think you're right. A lot of clinicians, physios, massage therapists are almost nervous to work on pregnant patients.
Yes.
And so that's where you seeking more education,
and I would have felt that same way. I think I would have felt that way coming out of school, and especially not having had children myself initially, just not knowing as much about the pregnant body, that without going to seek further education, that I probably wouldn't have felt as comfortable. I mean, even the basics of it, you hear you can't have massage until you're past your first trimester. If massage is something that has been part of your regular life all the time, then that risk doesn't change.
Right.
It's no different than a runner who is, do I still run while I'm pregnant? Absolutely, if that's what you've been doing all along.
Right. It sounds very similar to those exercise prescriptions.
Exactly.
It's very patient dependent. Yeah. It's not like a blanket statement.
And just having a practitioner who is aware of, what those contraindications in pregnancy look like. And a lot of them are related to blood pressure, some different things, diabetes.
Placenta previa, like where the placenta's positioned.
What any of those high risk conditions could be. That would be, you have to be aware of that. You have to know what they are, because if your client's coming in and saying like, I have this, what can you do for me? We need to have options.
Yeah.
Table positioning is a big one. I don't feel I necessarily learned as well on how to maneuver to get my client comfortable.
Tell us more about that. What do you mean by table positions?
So table positions. So the nice thing about prenatal massage is when you come in, we do have a cushion that you can lay on, which is amazing when you're sick of laying on your hips.
Like lie on your stomach.
On your belly, yes. Yeah. So it's cushioned and it's supported under the hips, as well as it even supports the breasts, the rib cage.
So a little cutout for it, right?
Yeah. You're looking at it and you're like, what is that? It takes a little bit to learn how to get into it, but it's all good.
I swear some people come just to like nap on their belly.
We probably should offer that as a service at this point.
Rent it out. Yeah.
So we have that option, and then we have the traditional side lying, and additionally here we do have those side lying cushions.
Special pregnancy cushions just to lie on your side. Yep.
Exactly. And they support you in all the right places so that you're not rotating in the hips the wrong way. It's putting that, like if we're working on your back, you're nice and straight, and you're going to feel comfortable. And so we can even do as much as chair massage. Like realistically, when it comes to prenatal massage, there's always options. And sometimes we have to adapt based on something like somebody who has high blood pressure. Like we have to do positional changes, especially if you are feeling unwell. Like there's different things we need to do along that hour to get you that, or maybe we're going to recommend a shorter treatment.
Right.
But it doesn't mean if you're considered a high risk pregnancy that you shouldn't have prenatal massage or manual therapy. You just have to have a practitioner who knows how to work with those risks,
right?
Essentially.
I think what's nice is that I think a lot of our local gynecologists and the doctors that are handling obstetrical care are happy to kind of do some multi-practitioner work and like have conversations about what's the best course of treatment for their patients.
Completely agree. Yeah,
which is really, really nice. So I guess that's a nice option to know that there's different positions that people can be in, and we have different like time slots. If someone can't tolerate a massage for 60 minutes, that there's options for potentially shorter.
Definitely don't swear it off. Like, don't think that you I have this and I can, or I couldn't lay down my last pregnancy, so I probably can't do it this time. Like, reach out to us, talk to us. Like, we probably have options for you, unless it's been completely not indicated by a healthcare practitioner. Then we definitely try to make it work.
Yeah. Oh, that's great to know. Okay. So tell me a little bit about, like, do you help with swelling or supporting any pain in that regards? I was like super puffy. So I think my shoe size went up 2 sizes at the end of my pregnancy.
I think that's pretty normal for a lot of people. That you definitely carry extra water weight and things in different areas. So to an extent we can, yes, alongside of other changes and making sure that you're staying hydrated enough. Looking at like how much I find, like, obviously extremities are where we can see the biggest benefit in doing like a very slow like drainage techniques. That comes down to positioning too. So if we're positioning you in a certain way to help with that drainage, there's not a ton of evidence to support like drastic changes because some of it's hormonal.
Right.
So we can only go so far with it.
Measures of comfort, basically.
That's what it becomes. So a lot of clients do feel that they have a lot of change in their level of comfort and what they can do. So if they have a lot of swelling in their legs and their feet, they come in, they have treatment. It's usually more regular than once a month, I will say. You're probably looking at like every week to see a big difference. But with that, you're going to have more comfort in walking. Maybe you have other kids you're keeping up with, and you've got to be able to move around. Right. So it may help with the comfort level. We can't say that it's going to make it go away.
And here's where it comes down again. It's like, well, yes, like you're still pregnant. The condition, the condition is still there, right? But again, I don't want to like dismiss the fact that comfort does mean a lot to a lot of people, right? And I would say that we have clients that come in even just for like anxiety and relaxation because the stress associated with pregnancy, and especially if there's anxiety about an impending birth.
Sometimes just talking it through with a safe person makes a big difference. You have a whole hour with us. Obviously I wear that other hat, right? Which can just be reassuring to say, okay, have you chatted with your practitioner about this? And just prompting those things of, okay, well, have you taken a class? Is a class something that would ease these anxieties? Right. And some people find that relaxing kind of as a wonderful benefit. Oh, well, your clients are so fortunate in that you can kind of almost put on your other hat and have a discussion about childbirth. But even your knowledge of like pelvic floor conditions and knowing like different birth positions and like being able to refer them, hey, like maybe you should go see the pelvic floor physio, or maybe you need to talk to your doctor about this option XYZ, right? I think that even that, just having a good understanding of who the other team members are that might be of benefit to them can be incredibly useful. We get that a lot of the, I didn't know I could do that while I was pregnant. I think pregnancy has become a condition. And that it's not the same as if you're sick with something. It's just a matter of how can we adapt it, and it's finding those practitioners who are trained. And
I think we've harped on this point already, is that a lot of people are uncomfortable treating pregnancy because from a basic education standpoint, in most of our professions, it's not talked about that much.
Well, like, the evidence isn't always great, you know? Like, it goes back to that ethics. It's the same as my pediatric hat. Seeing the babies, a lot of what I have based my treatment plans from has to come from, like, the older pediatrics and the adult body and adapting it to a smaller body. Right. Because we don't have the strongest, like, research-based evidence in studies to go from. So having that, knowing what we can have access to, which is like training like I've taken over the years, and then the clinical experience, it makes you more confident, of course, in treating this population. But I can see that some practitioners are just like, we don't do prenatal massage, and I respect that because it's like you want to know the changes you can make.
Know your limitations. And I will say in the last 10, 15 years, I have seen such a huge growth in women's health research. I feel like we were so far behind, and there's really been a big push, like a big movement to try to increase our awareness. Like
I
we
would say
see
too.
the International Olympic Committee that's trying to push exercise during pregnancy. We see more and more interest from the clinicians, and so more research is being done, and so more courses are being offered. And I think we just have practitioners that are now that much more confident in what treatments are safe and effective in a pregnant population.
Completely agree with that.
Okay, let's switch hats. Tell me, how the heck did you get involved in becoming a doula? What is a doula? How do you train? What's childbirth educator? How's that different than a doula?
A lot of questions to answer.
Yeah. Start from the beginning.
Okay, so 5 years ago, actually before I had my first child, I looked into, like, I was planning to become pregnant. I was looking at what's out there for education, for childbirth education. At the time, we're looking pre-COVID. So there were still some options in hospitals, which are few and far between now.
Yeah.
And then I looked into training through Doula Canada, which is a Canada-wide program. And they had what was called, at the time, I think it was a perinatal educator, but they just go by childbirth educators. And it was a mostly online program. I also thought it had a lot of benefits to what I was already doing in my massage career.
It like supplemented your
like
massage
understanding
knowledge,
like in the pregnancy side of it, and then that postpartum, and like what's happening physiologically and anatomically through birth.
Right.
So how can those massages at the end of your pregnancy help with that?
Right. Excellent.
So I took that course, wrote the exams for that when my son was a couple months old.
A great time to be writing
I know.
exams.
My timing is so good on all these things. And then essentially I started teaching. So I was teaching for a few years before expanding to having a doula agency now, which is essentially that we've got 5 team members. So we've got birth doulas and postpartum doulas. I myself am a postpartum doula.
So explain the difference, because I think people don't even know what doula is, and they don't know that there's different types of doulas.
So a doula is not a midwife. That's my first thing. That's a question we always get is, can I hire a doula to have a home birth? No, you cannot. Ethically, you cannot. And it's not in the scope of practice for a doula. So keep that in mind. I'm sure there's people out there that maybe push those boundaries.
Right.
We can attend a home birth with a licensed midwife there.
Okay.
So a doula is there for the expectant parents.
Okay.
We are entirely there for the birthing person. We're there for the partners to support them.
So you're a support to the birthing person, not a medical aid to 100%. The baby.
Exactly.
Gotcha.
So we actually don't do really any immediate care for the baby. That's all still followed through a health practitioner. So even though we're a part of your pregnancy as a birth doula or an educator, we are not offering any medical advice at any point when we should not be. So if anyone wears a doula hat, they shouldn't be.
Okay. So like, what does what were you calling? So a birth doula.
A birth doula is going to be somebody who supports you through pregnancy with education, guidance. They're going to be at the other end of that phone when you have a text at 10 o'clock at night, maybe when you have a.
What does that look like? Like, what are the texts? What are you teaching
things like they're at near the end of pregnancy, and they're like, I'm having this happening, and maybe they're having some cramping each night, but it's not turning into anything.
Right.
You're going to reach out to that doula, and you're going to say, what are my next steps?
Right.
We know that we don't have an on-call OB. Right. Like, we can call the hospital may get back to us, we might be able to talk to a nurse, but they're not going to be able, they don't know you, they don't know necessarily your entire history and all that, or what your personal choices are, what your birth wishes are, and those types of things. Your doula is the person who's going to help with that, and they're going to help you navigate things like when to go to the hospital, what types of medical intervention you want.
Right.
And just because a doula, a lot of times they get characterized, birth doulas, as somebody who's like, oh, they only support unmedicated birthing.
Right.
Absolutely not.
Okay.
In all of our curriculum that we teach everything from every single type of drug you can have during birth to having absolutely nothing and doing it unmedicated.
Right.
So it's very wide range. It's all evidence-based information. We're working with the body, working with the anatomy, working with the physiology. That birth doula is trained to help you and guide you through that.
So similar to like a well-educated partner
100%
would be doing, right? So like, you're not making the medical decisions, but you're there to present what some of these medical terminologies are.
Exactly. And to prompt them to ask questions.
Right.
So if your healthcare practitioner comes into the room during labor and says, this is where we're at. We have 2 roads we should maybe go down here. Your doula is going to say, okay, we talked about this. Do you remember when we had our one-on-one meeting when you were pregnant? this could lead to this, and there's some pros and cons, and you know that this could lead to this. So do you have questions for that provider?
Right. Which so many women are actually very anxious to ask questions.
Yes.
Or like, while you're trying to produce a tiny human, like sometimes you don't think clearly about what questions
it's overwhelming.
you meant to ask,
Yes.
right? And especially, I do find a lot of people, like, when a practitioner comes in, even for me, like, when we do our pelvic floor birth prep, like, I always go back and be like, okay, have I said any words that you don't understand, or that you were nervous to interrupt me and ask? And, like, just having that support person there that's like, no, you can, like we can stop. We got 2 minutes. We can stop and have this discussion, right?
Essentially, there's a very few amounts of time in a labor and birth situation where someone is going to be in such an urgent situation that they don't have time to ask those questions.
It does happen, and that's why we are thankful for the providers.
We are. And you know in those moments that that's the only option we're doing this, because somebody is at risk, and a doula is never going to interfere in that.
Right.
That's not their role, and they're not there to necessarily speak for you. Like, they're not going to speak for you. They're going to talk to you and say, do you have questions for that? Take a deep breath. Let's think about this. What is it that you want? Remember on your, we always do a birth wishes, or we sit down and we talk about it after they've done the class, so that they can say, I like the idea of this. I didn't love the idea of this. And this is where we reduce that risk of birth trauma.
Right.
So doulas do have there is actually a high correlation of reducing the risk of birth trauma.
Well, just education is so important. I have so many women that like, I didn't really know anything going over. Like, I didn't know that 4th degree tears could happen. I didn't know that forceps were a thing. Like, they just really didn't know.
Most don't know what the effects of something like Pitocin are.
Yeah.
Like, they don't know how they could feel if they say yes to that. And the
pros and cons. Right.
Exactly.
Yeah.
And what other options do you have?
Right.
And that's what always comes down to, is we don't always get presented with that beautiful, like, okay, what are the benefits? What are the risks? Like, what if we don't do anything? What are my next choices? And we don't always get the moment to slow down. Like, even myself in labor, and both times, there's probably questions I would have asked.
Well, and I think you're right. Even locally, we've really seen a reduction in what the public health system is offering as far as prenatal classes. And I understand why. Right now, we're in a tough spot in healthcare right now, where we don't have enough physicians.
We're running short everywhere. Yep.
And so, some of those kind of bonus programs are the first things to be cut, but they really are important. And so it's really nice. Again, I think there's some videos that are filmed on our local health district authorities web pages, but that doesn't give you the opportunity necessarily to like speak and ask questions when they kind of arise during that education time. I've also noticed some doulas that are very good at like helping with positioning during birth and encouraging
and being hands-on,
side lying or like moving them like their hip into a certain angle again.
So we teach a lot of that in the class. Yeah. So typically any of the classes we offer a hybrid class as our main birth class. And in it, there's a lot of online material. There's 7 modules you have access to. And then you come and do a live class with us. And typically in that live class, if you have a hired birth doula, they're usually there too. Yeah. So not only is your partner there learning in the live class, but if you've hired one of our doulas, they're always there as well. Okay. So they're getting to know you. They're going through these with you, deciding what feels good, what doesn't, kind of taking note of all of that. And we know that, again, we're running short. So nurses, when they have the opportunity, labor and delivery nurses, I mean, they're amazing.
Oh my gosh.
And some of them are so hands-on that they're almost doula-like, but they don't always have that opportunity. Yeah. So you have to take that chance and that risk of like, is there going to be somebody who can be that hands-on with me or not?
Or they're going to be 15 babies born that night at the hospital.
Right. And then it's like maybe you're not going to feel as heard or as seen in those moments. And birth is a very like once in a lifetime it's experience. It's your birth. It's your story to tell. So when we can have the control of some things, we know babies are very they do what they want on their way out. And we can't always control all the things, but when you do have control of some things, that again makes
people feel better.
Exactly.
Yeah.
That experience becomes more positive and empowering, and you feel like you've had more control of what your body is doing and those types of things.
And it's an option for some people. Like, there are some people that want to have their mother and their grandmother and their mother-in-law present. There are other people that do not want that and would rather have someone that they feel like is a little bit removed from their personal life that's there present. And
you become a neutral party.
Yeah, exactly, which is really, really nice. Yeah, I think that's great. The other thing that I will say as a pelvic floor physio, I love when someone's already taken a birth prep class by the time they come see me, because that means I can spend much more time focused on their actual pelvic floor. Yep. Like, I can really do like hands-on and do like the coaching. And if they've already discussed like, I'm interested in doing a side-lying birth, or I'm interested in doing a 4-point birth, a birth on hands and knees, right? Then I can be like, okay, well, let's see what your push technique is like in those positions.
Right, and that's the part we can't do.
Yeah. So do find it works. Well, and it saves me time. I don't have to go through all of the positions.
Yes.
And I'm like, okay, great. Roll onto your side. And we just put like our fingertips over top of their clothing and like, hey, show me what you think a push is. Show me what you think a Kegel is. Because it's really wild to feel that sometimes like in a sitting or standing position, someone can push and Kegel very, very well, but then you put them on their side or you put them in another position and they cannot do it at all. So then I'm like, okay, go back to, like, go home and practice.
Yeah.
Right? Or go back to your doula and see if they have a suggestion for like a modification for that posture that maybe we will get a better pelvic floor response in.
Yeah,
so
more relaxation and more contraction, like more control. Yep.
So I do find like it works very seamlessly as a team.
So
that.
I would always recommend doing your birth class if you're going to do one in your second trimester.
Yeah.
For the sake of that, we're typically sending them to or trying to in that early third trimester because you've had some questions, you've had some things answered, and now you're like, okay, we are going to really nail this down into what I would love to happen, things I'm open to, things I'd like to avoid.
Yeah.
How can I do this keeping in mind my pelvic floor, my baby's position, all that stuff.
Exactly.
So it's like in a perfect world, we get you to come to us in that second trimester, do a class. And when you have a doula, you also have 2 one-on-one sessions where the doula comes to your house, sits down and talks to you. It's part of the package. So you get a couple hours of that one-on-one time. And then we take that information. And when they come see you guys to do birth prep, then they're like,
then they already know a little bit,
It's
which
not
is
like,
great.
It's hard when someone comes in and is like, okay, so like, what are you thinking for your birth experience? And they're like, I have no idea.
Yeah, I'm not sure.
And we've been there. We've all been there. Like, we've met all of you who have been there. And that's okay because you're not being given a lot of it in the public sector.
Yeah.
Which
we have handouts for that.
Yes, we have all the tips and the tricks and the goodies for it. But that's the thing. It's like finding that nice structure of when the education falls into it and where the support should start coming in. It's not just about the day of birth.
No, it should happen before that.
Yes. And then you should have that support after.
Well, so that's my next question.
Yeah.
Talk to me a little bit about like what does a postpartum doula do?
So a postpartum doula was often referred to years ago as a mother's helper.
Okay. Ooh, I like that.
Yeah. So you are there to facilitate whatever the mother needs to encourage that baby bonding time. That like feeding is a learning curve. Even it doesn't matter if you're bottle or breastfeeding, figuring out your baby's cues and what they need and different things like that, and then prioritizing your rest and recovery, managing a household. We know that in a lot of our families, this isn't the first baby.
Right.
A lot of them come to us that second time, right? So so we're making meals. We're focusing on mom's recovery. So we're, setting up sitz baths. We're getting them up and walking if we need to. We're making sure they're sleeping, but they're hydrating, they're eating.
So like domestic support.
Yeah,
basically.
100%. And that's where that mother's helper kind of comes in, is that like we're doing all the things to lighten the mental load of mom so she can take care of herself and the baby.
It's almost like when we used to have intergenerational homes and you would have like
There's a reason they were like that.
Yeah. Right. So like you would have family that would come help you.
We become your extended family.
Right. Yep. And it's not like society isn't necessarily set up. Not everyone's lucky enough to have like their mother or like family members living down the street. And
we have a lot of that right now. And we have a lot of newcomers to our area. And we're seeing a lot of inquiries of people who have moved here just from other provinces, other countries who really do have that intergenerational home set up and they don't have it here. So it's like, how can we help fill that void?
Right. Oh, that's wonderful. So it's not that you're managing like the postpartum medical aspect. Nope. You're not checking like the postpartum bleeding. You're not checking blood pressures.
We know what the norm is. Like and so we know the risk factors and we know like things we'd send you back to your care provider, things we would tell you are urgent and go to be seen by somebody. Same as for baby care. So if something's going on with your baby and maybe we're managing jaundice and stuff, we're not medically managing jaundice. We're just listening to you and reassuring you to follow your intuition on when maybe it's time to go back.
Right. When to contact a medical provider.
Exactly. Yeah.
Again, similar to like what a good friend or a family member is going to do, just you're very experienced at doing it.
Right. We've done the training. We've done the 2-year course. We've done the additional, because there's a lot of that stuff that we learn from other generations.
Right.
But that changes. Those recommendations and those guidelines change every year, it seems, about what babies need, don't need, what mom needs, what that recovery is going to look like. I mean, I'm sure 20 years ago, were they doing pelvic floor physio?
Well, this is where you have, like, I always picture, like, like the one generation fighting with another generation. Of, like, back in our day, we used to do it this way. And it's like, well, things do change. Like, every generation does things a little bit differently.
Even as basic as what we're putting on babies' bums for cream. Yeah. Like, that has even changed.
The bottle types. Like, how to swaddle. Like, it's just, so it's always nice. And you see so much conflicting information online. It's always nice to have someone who's actually physically there.
We try to avoid the Google. We've all been there. we've all been in those middle of the night.
3 a.m. Googles.
Yes. And so if you can have somebody to reach out to first thing in the morning, you can text us at any point. We might answer at 3 a.m. It's hard to say. We try to keep,
you might be up.
We try to keep boundaries, but we all have kids, so you never know. We will answer you back first thing in the morning and say, okay, like reach out to your family physician today, right. Or okay, like let's just stick to the plan you have from lactation to be like, let's stick to that and see how baby does by supper time. Or like there's just little reassurances there that, you know, not everybody's mom has the advice to give them. Not everybody has a friend who's had babies. Some of you are the first of the friend group.
Well, and I think that's very good. Like I think you've done a very good job at like understanding like this is where my scope of practice ends. Yes. Like this is my role, and knowing like I can't step over that. Even like every like physio's the same way. Every profession has like, this is as far as I can take you, and then I need to refer you on to the expert that can handle that.
And we have a great network for that now. Yeah. So I've been around doing it long enough that I have the different lactation providers that we refer to, and you know, the different clinics we send you to, because they're the ones that will take babies and some won't. And obviously all the people in this building, it's like, okay, well, I'm seeing this. Maybe you should see Adele for Cairo, because during your birth, you know, forceps were used, vacuum was used, and there could be, maybe baby was a little crooked coming out. So there's something that we can do, and it comes to referring. It's just knowing which professionals and where to send them. Yeah. I think that, and you see that with experience with birth and working in this population long term. Yeah. Well, that was 30 minutes. It goes by very, very fast, doesn't it? Is there anything? I can talk for
I know. Is there anything else that you feel like we haven't covered, or have we given people like a good sample of what it's like?
I think so. And I mean, I'm an open book, so I'm easy to find. Instagram, social media, Whole Mama Collective.
What are your handles?
Whole Mama Collective. Yeah, we're on Facebook, Instagram. We have a website as well, wholemamacollective.ca. Yep. All the team members, so you can see like our different backgrounds and everything are on there. We are booking well into the fall, and actually already booking for the winter for
So you
doulas.
book up like how many months in advance?
So
in case this airs
postpartum
at a different time.
Yeah, you got to start now. Postpartum doulas, like I'm looking at January, February right now.
So you're talking about 3-4 months in advance.
And the nice thing is, the earlier you book, we can offer payment plans. We can try to make it more affordable for people too, and just the availability of us, because we only have 2 postpartum doulas that primarily do postpartum. We have 2 that are both, right? But they also have to be on call for births and things, and so we have 3 total birth doulas.
So book your birth support person and early. Your postpartum support person early.
And the nice thing is in the packages you get a discount for the class, right? So it's like we can tie it all into flow really nice
together.
Yeah.
And if you're looking for Alicia, you can certainly find her at Reconnect Health Center. You can find her massage therapy handle is the pediatric RMT, so you can find her on Instagram, and we feature her on our social media accounts as well. You'll see her lovely face pop up every so often. So it's been really great speaking with you. Thank you so much for kind of sharing what your many hats look like in the run of a week. And reach out if you guys have any questions whatsoever.
Thank you.
Bye.